Welcome back. I'm so excited to have this guest on today. This is Dr. Mandy Rice. She is a trauma surgeon at a level one trauma center, a private practice general surgeon, solo private practice. And now she's also going to talk to us about what it's like to get pulled into your purpose and see a vision for the future and execute it. And so she's going to talk about how she's done all of these things and gotten to this point from where we all started, which was just, we were told to be surgeons and this is how it was. And now it's a little bit different. So this is going to be a really fantastic episode about what it's like to follow your the calling. And so, Dr. Mandy Rice, tell us a little bit about yourself.
Thank you so much, Amy, for having me here. I've been listening to you for a while, learning from you, and I'm very, very grateful to contribute as I can. So, I am from Texas, and I was originally a pediatric ICU nurse, and I thought that was my path. I wanted to do probably nurse practitioner at some point, and then I fell in love with medicine right away. So, my whole 7 years that I was a nurse, I actually was kind of prepping to be a physician. All the intensivists I worked with would have me round with them. I would go to surgeries. They would teach me how to read like the old films, from like chest x-rays or head CTs where it's like frame by frame by frame. So that was my whole exposure as a nurse, was basically a mini med school. And so by the time I got into med school and into my third year, I fell in love with surgery. And much to my husband's dismay, he's an anesthesiologist. So, as you can imagine, my one instruction going from the school classroom in med school, first and second year, and then transitioning into the hospitals, he said, just find something that, makes us about 150 a year, primary care, whatever, and don't do anything surgical. So my first rotation was general surgery, and I was like up at 3:30 in the morning. I was going to write my H&Ps. I operated all day, and I would come home and just divulge to my husband, debriefing of all the things that I did. And I think he figured it out, because about a week into it, I was driving home and I realized, uh-oh, I want to be a surgeon. That means I'm about to get divorced. So I went home and told my husband, and he was like, you know what? I already know what you're going to tell me. It's okay. We're going to be fine. And the rest is history. So I
I
got
love
into
that it
surgical
started like,
training, had,
uh-oh, she's going to be a
yeah,
surgeon.
yeah. I wonder when that hit his brain and if there was an existential crisis. No, but he's been a super supporter since then. I'm so grateful. But I always joke that I've been tutored. My whole surgical training was tutored by an anesthesiologist. He'd tell me, don't ask for negative twitches. Um, don't talk back. No. So it's been a wild ride. But so then I entered surgical training and had a tumultuous first experience of residency. Was able to transition out of the first place I was at and finished training in Pittsburgh, Pennsylvania, and I stayed there for my trauma training. And actually, during my chief residency year, when I'd already gotten into trauma fellowship training, I realized that I loved community surgery. I was with a couple of mentors that were just amazing, and I loved the pace. I loved the community aspect, how you just really towed in with the environment around you. I mean, my attending surgeon would have the phone numbers of all the hospitalists he worked with, and if he saw a patient and he had questions, their communication was amazing, and I just felt like that was a family kind of atmosphere. So, but I figured, I didn't know what I was going to end up doing, so I kept the fellowship position, and I'm glad I did, because I ended up now in part time at a level one trauma center, and I really enjoy teaching residents and doing the crazy stuff that we do at a level one trauma center. And then I come back home to my solo private practice, my day job, and really enjoy that, because I've towed in with the community. We live in a small community, and I really enjoy taking care of the patient and their families, and really having good experiences, and creating those roots that my husband and I were looking for.
I love it. And so when did you start this private practice and what was it that you were going for?
So 2 years ago, we started private practice, partially because I had lost my first position, and that's probably a whole nother podcast, because that was a rough ride, learning about difficult partners and things like that. Thanks to your coaching, I pulled through from that. And my husband and I decided, we want to do things the way we want to do them. I don't want 15 minutes for a patient. I want to take care of them, the way that I think is the most dignified, with the best communication and the best care. And so we went out and created our own solo practice. As my husband's a got his MBA at one point, and so he's our practice manager, and it's just me and my office manager, and we really enjoy the small clinic setting, really bougie, with plants and spa music and all that kind of stuff. And we have a coffee maker, and we just really enjoy the way we do patient care, and we seem to it seems to be very well received. So I take call one weekend a month at the hospital where I do my big cases, and that allows me the ability to get some more acute care kind of cases in addition to my long distance trauma center. And then so that was about 2 years ago we opened. Actually, it's exactly 2 years ago that we opened. So about a year
Congratulations.
in, thank you. About a year in, we started transitioning our minds. So what happened was, I'm now in my late 40s, and as my body was going through that midlife change, perimenopause and menopause, there was no resources for me at that time when I first started going through perimenopause. And it's kind of tumultuous to experience something like that when you're, finishing surgical training and starting your own practice. And especially when you don't have the support, there wasn't all the social media presence that there is now for learning about what we're going through, and what options are out there for us to feel better and protect our health and everything. And so about a year ago, as I'm going through and realizing that not only have I gone through this roughly, but a lot of my patients are experiencing similar problems and they don't have anybody to turn to. And I thought about this one thing, Amy, and I'm not sure if this will resonate with you or with the listeners, but in surgical training, I distinctly remember my attendings telling us that when we look over a new patient consult, if we see the diagnosis of fibromyalgia, that's supposed to be a red flag to us that this person is crazy and we should limit our time with them. I mean, I distinctly remember being told this.
Right.
And so unfortunately I didn't know any better. And, you're basically a prisoner in surgical training. So I didn't really have many thoughts of my own at that time. And so I just accepted it and tried to steer clear of spending too much time. But what I found was a lot of times they were just anxious ladies that needed to talk about what was going on and figure out what was going on in their health. So fast forward now, at the role I'm in now, I see all these women coming in to see me because I'm the only female general surgeon in town. I'm the only fellowship trained female general surgeon in town, and I'm the only solo practitioner in town. So I get a lot of girls that come to me for gallbladder disease, for hernia repairs, for soft tissue disease, you name it. And so I'm finding over the past year that consistently women have the same complaints, the same problems, that I had been experiencing. So it started dawning on me that, there is such a complex array of symptoms and then chronic diseases that can occur when patients don't get the care that they need in this menopausal transition. So about this summer, I met a practitioner who does menopausal care and is certified by the Menopause Society. And she really opened my eyes. She's now going to be my future business partner, but she really opened my eyes to see that this is a big problem. And it's like once you see something, once your eyes are open, you can't unsee it. So now all of a sudden I see, oh, yeah. I mean, the girls that come in and they've got this myriad of symptoms this long, and they've seen like 3, 4, 5 doctors to try to get solutions. It just became extremely apparent that we need to help. The need was huge and is not being filled. So OB gynecologists are busy and they're not trained formally for menopausal care. Usually they describe a number of maybe 1 to 6 hours in their whole 4 years of training for menopausal care. Primary care physicians aren't taught. I know I wasn't taught in medical school, let alone surgical training. So the need is huge. And I decided that I could train for this just like I've trained for anything else that I've done. So I trained for the menopause care. I took the Menopause Society's certification exam and passed. And we opened up a new business, Direct Integrative Health of Hot Springs. And we are seeing women in the perimenopausal and postmenopausal phases and helping them to gain back their life. And it's been quite a rewarding experience.
Amazing story. And there's so many things that about your story I think will resonate with people. And it's something that I've seen too and experienced. The idea of we have this training, we have an idea what a surgeon's going to be. Then we have a rotation that pulls us in a direction. It's like, okay, this is what I'm going to do. And then we go into a job, and this is when we start realizing that our paths are different. And when we're in jobs, we're either going to be pushed out of them or we're going to be pulled out of them. But we're always undergoing evolutions in our job. Even if we never leave the same physical hospital, we're always undergoing different changes in our career. So none of this is a big surprise, but there's definitely always a push and a pull that leads us into different areas and where we're meant to be. So when you find that calling, it's usually like a pull of some sort of I see a need and I think that I want to fill this need. And it starts, I think, with a mindset shift of I can do this myself. So it does not actually surprise me that when one job felt you felt like you were being pushed out, that it pushed you into a new mindset shift was sounds like I just need to do this myself. They don't understand me. They don't get me and but I get me. And creating that belief in yourself shows you that you start actually listening to yourself. You become the authority for yourself. And when you're the authority, you have a built-in advisor. And then when you realize there's all these people around me that also like it's like you sound the call. And then other people hear the call, and your calling now becomes the calling for other people, whether it's your husband as the MBA or MBA and your office manager, or this friend who now becomes a business partner. It's when we have clarity on our mission, we start becoming the one calling and pulling people with us. And so a lot of this is, I think, how things evolve. This is how it evolved for me. I was in the military, then evolved into employee practice because everyone said I was supposed to. And then I evolved to private practice because I realized that was what was going to work for me, which unlocked a whole different way of thinking. And then I felt the need of filling in those lessons not taught in residency. So that's how I think a lot of us are evolving in our career is when we start listening to ourselves. So I definitely think that you have a very like a great blueprint and a story that a lot of people can relate to. It's the details that may be different, but there's a lot of commonality to it too. So how has it been to build this team and to express this vision?
I remember distinctly when that mental transition occurred. So it occurred in part, like you said, when we started the solo practice 2 years ago, or 2.5 years ago, is when we first started that direction. But I remember distinctly it was about a year ago, well, it was fall of 2024, when I was starting to see this problem with a huge gap in, women in midlife, that just seems to be a lack of care for us. We haven't been, researched much. There aren't the same medications available when things change in our bodies like there are for men. It's just a huge gap. So I remember thinking, gosh, I wish that I could help teach women at large, but who am I, right? Who am I? I didn't know my voice. And then one day it just dawned on me, and I was like, hold up. So I'm a trauma fellowship trained general surgeon, dual board certified. I'm in this community. I'm the only person like me. So I have a voice. I have an expert voice. I think it started because when I started taking call, or when I started going to work part-time with my friend at the trauma center, it was a big stretch for me because I'd been an employed surgeon before that. And I think that stretch is what was kind of the impetus for feeling like I could do these things. But really being able to be in tune to what my values were, what my goals were, and just how I saw myself and my abilities. And that was really hard because we're really not taught to sell ourselves or sing our praises, or you always hear terms like toot your own horn, and I felt like that was not a humble state. But I realize now that it's not a state of arrogance. It's actually a state of humility. Like, I have these abilities and these skills, and there is a need in my community, and I have such, like, I'm the eldest daughter empath, right? So I have such empathy in who I am and how I practice medicine and surgery, that of course I'm the perfect position to be able to do this. And why did I not see this? So I went to a friend of mine in the Women's Leadership Alliance for our city, she and her friend had been kind of disruptors like that and had created this nonprofit that helps women leaders in the area to gain leadership abilities and a sense of community. So I went to my friend and I said, hey, do you think this group is willing to help me? Because I want to teach women more at large about their health. And she said, yes. I don't know what it's going to look like, but yes. And so we started the Women's Health Expo last year, and we had our first official expo in October of 2025. It was extremely well attended. We had over 400 attendees and 70 healthcare exhibitors, and we had 3 panel discussions. I'm the medical director for the expo, and these panel discussions were amazing. We talked about kind of like all things heart, so heart and lungs kind of talk. We had a cancer talk, and then we had a hormone talk, and it went swimmingly. And I feel like that was such a wonderful way to disseminate as much information to help get ladies healthy as possible. And it really sparked something in all of us. And it helped me to see that I did have the ability. I do have a voice, and I have a desire, and I have the skill sets, and I'm gaining more skill sets. So at that time, actually, I sat for the Menopause Society certifying exam about 2 weeks after that expo, and I passed the exam. And my husband and I decided that we were going to move into that space and just roll with the momentum. And so we started our other practice, our second business. And now one of the girls that helped me to learn about menopause care, she's the only other menopause certified practitioner in town. She became my business partner. We're going to open this women's health clinic together. But as you said, it's kind of infectious when you learn that autonomy and you recognize your voice and your role kind of in this world or in your community. It became one of those situations where we started helping each other. So now my friend just opened her own clinic last yesterday evening, and she hadn't been aware that she was going to do her own clinic, 6 months ago. And then all the women that we now have on board with us to start moving forward, getting ready for the women's health clinic, excuse me, which encompasses a registered dietitian, a physical trainer, a personal trainer, a physical therapist, a pelvic floor specialist. Um, who else? We have a mental health expert. So all these, a qigong instructor. We have all these girls now, and each girl. It's so interesting that as we've been communicating with them and asking them to become a part of this group, it has stimulated their growth. And so now like they're getting their own LLC and they're getting a certification in whatever their desire is. And like they're moving forward independently. It's just been this beautiful snowball effect of women empowerment and communication and creation of that sisterhood community. It's very, very fun and invigorating to be a part of.
Yeah, it's contagious. And then you start to realize that, it's like a lighting a match, and there's this whole line there too that this match lights these two, and these two lights these two, and then and so on and so on. And before you know it, you start looking around like, oh my gosh, I'm a community builder. How did that
Yeah, that's what it
happen?
feels like.
Yeah.
That's what it feels like. It's so wonderful. Yeah, it's so wonderful. So we're having these focus groups that we'll do every month until we're able to get the women's health clinic started. And so it's all of us girls coming together it's open free to the public. And we just have a couple hours where we'll talk about, kind of didactic portion, what is perimenopause? What is estradiol? Kind of learning about the body. And then the second half will be where we split up, kind of husbands and male supporters in one room. And then we have another room for all the women to go and just have a support group type of a situation where girls can just talk about their stories. It won't be for specifically medical advice, we'll be clear about that, but it'll just be a place to be able to vent, like my doctor told me I was crazy, or I got diagnosed with fibromyalgia, and, those kinds of stories, to be able to lend that more empathetic support, that I think will really help. And it's a way for all the ladies that are involved to kind of free market themselves to talk about what they do and offer their services to the community. So it really is a win-win. So we're excited. Our first one's next Tuesday.
Amazing. And so how did you find all these people? Like, how did you know to build the team? Like, if you were advising someone who's like, this sounds like a great idea, what were some of the lessons that you learned in building this team? And, what are some of the pitfalls you maybe want to warn people about?
Yeah. So being able to be clear about what our goal was, really, really clarifying the goal in what we're doing with the women's health clinic, I think was really important because, you can get sidetracked by shiny objects here and there, but being clear about the fact that it's education, it's evidence-based medicine and education that we're going for, really helped. And then as far as the team building, making sure that each person that we're partnering with is like-minded as far as how they approach patients. So we communicate, or we're building partnerships with people who also are empathetic, treat people dignified, use evidence-based care and things like that. So there have been people that, we've come encounter with that, or come that we've encountered that, maybe they have the credentials, but the way that they communicate with people is harsh, is unkind. Maybe they're not always very, clear about things. And so we recognize that we don't have to be open to everybody. We're building a team of like-minded individuals who have the same type of goals in what they're doing in patient care. And I feel like I trust each one of those members that I'm, becoming partners with and that we're moving forward with, that I don't have to go behind them and apologize if they, speak out of turn, or unkind to someone. I don't have to worry about things like that. I know that they're doing the most evidence-based care in a kind and an empathetic way to people. And they have built good rapport with people already independently, and then we're coming together. So I think those are some of the biggest takeaways that I can offer.
And what can a patient expect? So, how do you find them? What happens? How is your business set up? Is this like an insurance base? Is it cash base? What is that patient flow like?
So a lot of the buildup has been in more community building. So sending flyers to the primary care doctors that I've already been in communication with my solo general surgery practice over the past couple of years. Making those touches. In robotic surgery, we talk about we want to get enough touches, on the robot so that our hands stay fluid, and our left hand and our right hand and our mind are all working together. And you need enough touches on the robot. I think it's the same thing when you're talking about community-based practice, is that you have to have those touches. So we've had primary care provider dinners before, where we communicate what we do. We've gone to visit them with, baskets and flyers about what I do. So we've built that rapport already. And so now I just make those touches, either sending a flyer by email, fax, and then even texting some of the referring providers that I have a lot of patient referrals from. And so that's kind of the way we've towed in as far as getting those fingers out of what we're doing. And then really it's been about some community development. So my partner, Mandy Burton, who's the other menopause certified practitioner, she's a urogynecology nurse practitioner and menopause certified. So she and I have done some community things for free. Like this was so fun. We went to one of our friends' boutiques. We called it Pumpkin Spice Latte Perimenopause Talks, and we brought some pumpkin spice lattes, and we set up some chairs right in the middle of our friend's boutique. Our friends gave them a 25% discount for the 2 hours that we were there, and we just stood in front of them and talked about what we experience in perimenopause and menopause. We made definitions. We talked about what hormones were and how we could help replace them when our ovaries fail. And it was really, really well received. And it helped us to kind of get the word out there about what we're doing education wise. And then we just did a keynote last week for the Women's Leadership Alliance, the Hot Springs Women's Leadership Alliance. And that was another way to get the word out. So it's just like, my husband's the CFO mindset, right? So he thinks that a double board certified, now triple board, I guess, if you include the menopause certification, surgeon should be paid for everything that they do. But with my CEO mindset, thanks to my good friend Amy Vertrees, I see how it's a lot more of the legwork that doesn't directly get paid back, that you're towing in, and like you're paying yourself. You're investing in yourself for the future, and investing in your patients in the future by doing all of these different touches in the community, whether it's speaking gigs, or going to put out flyers, or just spending extra time when you're in a community program that just allows people to see you, to learn about you, and to really see my passion, and then the referrals are coming. So
I love
it's
it.
one of those, if you build it, they will come.
Amazing. Yes, when you build something that is authentic to you and you build it with a clear mission and you have the calling and other people join you, then it's inevitable that people will come. But also like any business, it's an investment. You're either going to be investing your time or your money, and a lot of times both. So the idea of a business is completely different, and I'm so glad that you took the lesson of this idea of it does take time. The role of the CEO does cost time to put this into place, but by laying the groundwork, it's like, what does it matter if we don't make much this year if we built something that's going to be around for years? And, does it matter I don't make much now if I build the groundwork for something that'll make $1 million next year? Like it's entirely possible. It's the whole idea of breaking ourselves free of the idea that we are only paid for hours that we work or cases that we work. And this was the whole basis of the Math Not Drama webinar, which is we don't think like business people, so we don't get business results. But once you unlock that idea that, this is an investment of my time and money, and this value bank is actually can be translated into multiple different things, I think you're such a great example of.
Thank you. I went to the Lead Her Summit in Dallas this last November, and they talk about that building your brand, and that's really what it's about. It's like these are the things that I'm passionate about, the things that I'm also well educated and skilled at. And they both come together so nicely when you have a focus that, in my opinion, is so, like you said, is so well intentioned. We want to educate women, we want to get our community healthy. There's just no way to lose at something like that.
And I'm curious what your thoughts are too, because I know that even before we started recording, you talked about finding your own voice. And before you found your own voice, whose voice were you listening to?
Everybody else's seem to be the loudest
Right?
ones were the most negative and obnoxious.
Yeah. If we think about it, like before we hear our own voice, before we are the authority of our life, everybody else is. And so luckily, most of the time we're surrounded by people who are generous and helpful and things like that. But a lot of times you could find yourself in a job where if you keep listening to some of these voices, you may end up following a path. And, unfortunately, what can happen is when you're on the wrong path, you can get kicked off of it. And it can be very jarring to have an experience that's traumatizing. And that's the whole idea behind the difficult partner coaching and that I do is that everyone that comes across our path is meant to show us something. And if anything, it's to say, like, well, I listened to their voice and they were wrong. So maybe I should listen to my own. Sometimes it's as simple as that.
This is totally where you saved me a couple of, what, two and a half, almost, yeah, about 2.5 years ago, I guess. For that very reason, is like listening to everybody else, especially the loud, obnoxious people, was the most harmful thing to me. And it really took that breaking point to be able to see, oh, wow, I have totally missed not only my health, but my voice, you know?
Mhm.
And that's a very freeing, you hit the nail on the head. It's such a freeing mindset. And it's a growth trajectory at that point. It really feels like sky's the limit. For example, the expo. So we went there, and now I'm still partnered with my friends. We're going to be doing this again this year. Now we're going to be at the resort casino in town because we already outgrew the venue that we were at with those over 400 attendees, and so now we're going to be on a big stage, and it just keeps going. It's like it's such a wonderful thing to be a part of, and it requires that curiosity. It requires that finding your voice, having the gentle confidence, I like to say, to be able to move forward, even if you have those voices that come down. I have another hat that I have on right now is I'm writing a book, basically like a memoir slash helping others kind of book. And one of the chapters is the mental muting of the haters, because I find that those voices are still there. But when I can mute them mentally and process through that, that imposter syndrome that we hear about so much, it's a practice. It's a practice to, have those terrible voices return. Maybe it's exact things that they said. Maybe it's a mindset that they shared, or actions that they shared. But being able to then quiet that by all the things that you're doing now, that you're proving to yourself, why those voices demand to be muted, because they have no belonging in your brain anymore. They have no power, and they are gone.
Yeah. And they actually had a really useful part in our life. And that's the one thing that I have found most comforting because the first thing that I think about when that happens is like, who are they? And then I get really mad at them. And then I realize, well, who was I to listen to them? And then you
Yeah,
realize,
have you ever heard that phrase, like, don't, well, gosh, I'm gonna mess it up. It's something about, if you wouldn't, like, why listen to their
Mhm.
judgment if you would never take their advice? I know I'm messing up
I
the
know
the
exactly what you're
saying,
saying.
but
It's like, if we would never go to someone for advice, why are we listening to their opinion?
exactly,
Which means we've already
exactly. That's
determined this is not the right person to give us advice. And
right.
But when the voice is loud, or we think it's someone who should know, whether it's someone in a job or things like that, and I know that what we have discovered a lot of times in the coaching is that some people um, can only mentor us based on where they're at. And it may not be our limitation, it actually may be theirs. And either way, what it is they are not the right person for me. I don't even have to be mad at them. Like I don't have to carry any of this with me. This idea of like, okay, well, we tried this and I heard you and I tried that and it didn't work. And so I'm not mad at you. Bye-bye.
Yeah,
Saves you
that's
a
a
lot of headache.
very freeing thing. I remember you walked us through that one time, I think it was last year, and were helping me through a couple of these, I'd say traumatic experiences in my training and then in my first job. And I remember when that lightning bolt moment hit, when you were helping us walk through that, helping me walk through that. And it was just so freeing when I could see that one person, the main difficult partner, when I can see him with all of his faults and what he must be going through in his mind. It really helped to shape my ability to heal. It really helped show me that I'm moving beyond this because I see him now as just a character. Remember you're talking about the villains and what is it? The villains, the victors.
The
I'm
heroes.
going to mess that up too. And the heroes. And just seeing that villain actually turn not into a hero, but into a helper,
Yes.
because he helped me in a with a terrible path, but he helped me to see what my voice is, what my values are. And in surgical training, we're prisoners of the mind and the body sometimes. And there's no, unless you're in a program that I was not a part of, there's no real development of the person that you are, of the adult that you are, of the future leader that you are as surgeons in training. It's just, learn these cases, learn this didactic information. And we do a disservice to our trainees to not help them to be able to develop into fully functioning, self actualized adults that can then turn and become leaders because we are natural leaders, whether you're ready for it or not. And that's a difficult role shift.
Right. And it's interesting just to see like how along our way with the hero's journey, people come up and challenge us. And it's meant to offer a skill that we didn't have before. So we really needed these people to help us out. And then we come across someone who we realize, I don't need your help. In fact, you're hurting. Maybe I know. So this person allowed us to gain our authority over ourselves, and they can be very useful. But either way, they're a bit part in our play.
Yeah, it's true. It's true. It's such an interesting ride.
It is. And but all these people too, there's letting go the idea that I have to go back and prove something to them because there's nothing to prove. And that's really where honestly the freeing comes from, is that this person
Mhm.
was meant to be on my journey, meant to be on my path. What can I learn from it? What changed about me? What was necessary for me to learn about me? And now I can let it go and my relationship with them is complete because our relationships continue if we continue to have thoughts about them. So you may leave a job and still have a relationship with that person if you're still thinking about it. So I know in the coaching, what I really emphasize doing is that we resolve these relationships and they don't actually have to participate. So once we resolve our thoughts about other people, it will allow you to move on to the path that you're on because once you realize what they were there for, then my relationship with them is complete. I actually don't need anything else from them. And that's really honestly where the freeing comes from when you don't need anything from anybody else. And you take what you need from people that are there along your path to give you. And then you can actually even shift to being grateful for them as well. It's like, thank goodness they came along. I would never be where I'm at. And sometimes I sit in my office building that I built with a team that I brought together, with the expansion that we were able to do. And I look around and said, this is all because of difficult people and how I moved on from that. And so it's really interesting to be able to allow them to be a part of the story and you actually cast them in a different role, just like we were talking about. They're not a villain. They're whatever it is that the character that moves the plot along. So that's exactly what these people are here for.
Yeah, that's such a more productive way of looking at it. Now I teach medical students, even here at the solo practice that I have. I have a relationship with a nearby medical school. And so I get third years and fourth years that rotate with me. And it's such a different environment being in this like bougie little, private practice as opposed to the employed place where they go for their other surgical rotation. And it's so nice to be able to share things like this with them. And of course, I share you with them. And to be able to help them kind of expand their minds right now, not only to protect them as they're moving through into their residency training, but just to help stimulate their healing, their growth right now, while they
Mhm.
have a little breather with me, because it's a more calm rotation. And they really seem to enjoy it. And I hope that that's one of those infectious things that then they go help their
Yes.
fellow students, and that we can just kind of continue to reach back and help pull each other forward.
What an amazing opportunity for these students to open up their eyes to something that is, just even just the exposure can be so helpful. Well, this has been really fantastic, and I am so glad you came on the podcast. I'm so
Much.
grateful for you sharing your story. That's going to be such an inspiration for so many people to follow their own voice and follow their own calling. So, uh, Dr. Mandy Rice, where can we find you?
Okay, so my landing page is drmandyrice.com, and our women's health, midlife health and coaching is direct integrative health of hotsprings.com. And then my surgical practice is direct surgical care of hotsprings.com. And then I'm on all the socials, either under Dr. Mandy Rice or under our clinic's names.
Perfect. Well, thank you so much for coming on, and I cannot wait to see you in person tomorrow.
I can't wait to. Thank you so much for having me. It's been wonderful.
All
See
right,
you
great.
soon.
See you soon.